Hi, thanks for tuning in today. I'm Lisa Almaguer with Butte County Public Health. Today is Thursday, January 28th, and the information that I have for you is a COVID-19 vaccine update for Butte County. Today, we'll talk about some new vaccination data that's available to the public, some new announcements made by the state, what phase we are currently in for vaccine eligibility, and then finally, we'll have a question and answer session at the end. We've been collecting questions since Monday from the public, and we will do our best to answer all of those that have been submitted. The first thing I'm going to do is share my screen with you and show you how you can find the Butte County COVID-19 dashboard. So this page is the main Butte County COVID-19 website. The URL you can find up here in the corner, but it's buttecounty.net/PH, that's for public health, /COVID-19. And if you scroll down to this darker blue box, you can click this graphic and it will open the Butte County COVID dashboard. We have added a slide, it's slide number 2, and this is vaccine information. This information is updated once a week every Thursday, and it includes the total vaccines that have been allocated for Butte County, the total vaccines that have been received from this allocation, the total number of first doses ordered, and the total number of second doses ordered. And then this number here is actually, as they say, shots in arms. This is how many people have received the vaccine. So I wanted to clarify some questions that we've been receiving in regards to the number of first doses and the number of second doses. The number of second doses will always be lower as these doses don't get ordered until several weeks after the first dose. And this is mostly to do with storage capacity and logistics of keeping the vaccination cold for a long period of time. So I'm going to come back to you here and talk a little bit about some of the announcements that the state has made this week that may or may not have caused a little confusion. So hopefully we can clear some of that up. The first announcement is the state made is that they plan to become more involved with the vaccine at a local county level. The state has not provided detailed information to Butte County Public Health. So as of today, as of now, Butte County Public Health will continue to operate the vaccine response and rollout as we have been doing so by following the California Department of Public Health prioritized and phased approach. And I will refer to the California Department of Public Health as the state. It's a little easier, so moving forward in our conversation. The second announcement is a possible change in vaccine priority. So I'm going to share my screen with you again so we can take a look at the vaccine website and specifically the graphic that shows you what phase and what tier is currently eligible for the vaccine. Okay, so we'll go back. Here's the Butte County vaccination page. If you scroll down and take a look, oh, I'm sorry. This is the main page for the vaccine information. If you scroll down, these light blue boxes are additional pages of information. So I'm going to click on the COVID vaccine page, and here is all the information we have. And here's the graphic that shows you what phase and what tier we're in. So as a reminder, we are currently in phase 1B and tier 1. The red check marks indicate groups that are currently receiving or eligible to receive the vaccination. It does not mean that these groups have been complete. As soon as we complete these 3 groups, we are moving next to people that are 65 to 74 years old. Then we'll go into childcare, agriculture, and food. So right now, this is the phase and tier that we're in. The change that the state is announcing is that after we complete this tier 1 of phase 1B, this tier 2 and phase 1C will likely, it's not that it'll go away, but it will change. And the state will move to an age-based prioritization. The state has not provided any details about how they plan to break down these ages, but as soon as we know, we'll update this graphic and we will also let you know about this as well. So I'm going to bring your attention to another area closer to the top of this page. And this is where we've had the COVID vaccine registration information. And we've had thousands of community members already sign up to receive a notification when they are eligible for the vaccine. What I've added here is the online vaccine scheduling is coming soon. This means that if you qualify, so for example, if you are 75 or older, you currently qualify to receive the vaccination. And once this link is active, you'll be able to click on the link and schedule your vaccine appointment online. No email is required. And we have some information, some process in place for folks that don't have internet access. So there is more to come on that. Okay, so just popping back to you real quick before we get into the question and answer session. We have placed all the questions that we received into a presentation. So you'll be able to see a slide that has the question and then the accompanying answer so you can read along. It might make it a little easier. So I'm going to share my screen and show you, go through these questions and answers. And just take a second to get it into presentation mode. Okay, so again, this is COVID vaccine questions and answers for Thursday, January 28th. If I already had COVID-19 and recovered, do I still need to get the vaccination or get vaccinated? We recommend that you do. There's severe health risks associated with COVID-19 and the possibility of reinfection. So we recommend that everyone who wants to get the vaccine, even if they've had COVID-19, does so. Will people get to choose which vaccine they receive? No, the vaccine preference is not available. However, you can choose not to receive the vaccine at the clinic that you go to. Both Pfizer and Moderna vaccines have been reviewed by scientists and vaccine safety review groups as safe and effective. Will there be drive-in or walk-in vaccine clinics similar to the flu shot? So the best information that we have now, as the supply of the vaccine increases, more community clinics will be available, and these may include walk-in or drive-through information. And we'll always include any public community vaccine clinic information on both our website, through the media, and on social media. Will doctors' offices have vaccine to give to their patients? It's possible, but it's uncertain at this time. So once we learn more from the state, we'll be able to answer this question. Why are other counties vaccinating 65 and older as mandated, but Butte County is not? So clarification, the state has not mandated that 65 and older get vaccinated, but they have prioritized this group. Public health is prioritizing the more vulnerable 75 and older group first, and then we'll move to the 65 and older as soon as possible. And as we just reviewed that graphic, we are in phase 1B in tier 1. We are now vaccinating 75 and older, and coming soon is the 65 and older. What is considered an underlying or pre-existing condition that puts you at higher risk for COVID-19? So we've included a list here of various underlying conditions that do place people at increased risk for COVID-19. And we understand that anyone that has an underlying condition is concerned and worried and desperately seeking the vaccination. And right now, as I mentioned before, we're following the phased and prioritized vaccine approach that has been outlined by the state. And as of today, as of this date, the state has not provided any specifications that include underlying health conditions. If and when they do, we will incorporate those into our vaccination plan and for people who do have underlying health conditions. What is a realistic time frame for when the vaccine will be available to the general public, our population? So the state, California Department of Public Health, expects to have enough supply to vaccinate most Californians by summer of 2021. How will people who had their first vaccine get their second one? So it really depends on where you received the first dose. Some clinics are scheduling people for their second dose before they leave after getting their first dose. Others will receive a notification when it's time to schedule the second dose. I work in one county and I live in another. Where should I get vaccinated? You'll likely get vaccinated in the county in which you live, but it does depend on what type of job you have. So talk with your employer first about the vaccine availability. One example is education. Teachers and staff should be vaccinated at the school district in which they work. For example, if you live in Butte County, but you're a teacher in another county, you'll be vaccinated at that school where you're employed rather than in the county where you live. If for some reason the school is not providing the vaccine, or for some reason it hasn't been offered to you, you can still get it in Butte County, but you would have to wait until you qualify based on your age and not your employment. I was invited but lost my invitation, or I missed my appointment. If you missed your appointment, you can use the contact information in your original invitation to reschedule. If you lost your invitation, you can use the You Missed Me button on the Butte County Public Health COVID vaccine webpage. So now I'm going to go into a couple of reminders. These are questions that we received that we've already answered, but have been asked again. So this is about symptoms and what to expect after the first or second dose of the vaccine. So it's important to note that not everyone experiences symptoms, but here are some possible. So in the arm where you got the shot, tenderness, redness, and swelling. Possible other side effects, fever, chills, tiredness, and headache. Another reminder, I'm an individual. How will I know when it's my turn for vaccine, and how will I be invited? So you can visit the Butte County Public Health COVID vaccine webpage, and then the online vaccine scheduling is coming soon. You can also keep in touch with us on Facebook, through the local news media outlets, and through healthcare providers. Reminder, I'm a frontline essential worker in phase 1A. I believe I was missed. If you're a frontline essential worker in phase 1A and have not been invited from Butte County Public Health or your employer, please complete the registration survey on the vaccine website. You can still get the vaccine. You can just select the You Missed Me link. Reminder, I'm an employee business owner in phase 1A and I believe I was missed. If you are a business employing frontline essential workers in phase 1A and have not been invited from public health, please complete the registration survey on the public health website. Reminder, how will the availability of vaccines for the different tiers be communicated? So as we saw earlier in our conversation, I showed you the vaccine graphic. So we will keep that graphic updated on the Butte County COVID vaccine webpage. We will make updates on Facebook and through local news media outlets. Okay, so coming back to you, as always, information about COVID-19 and the vaccination can be received by calling the Butte County COVID call center, and that number is 552-3050. For now, just some reminders before we wrap this up. The vaccine is still by invitation only. Again, you can get more information by calling the call center or visiting the website. But we do ask that you don't call Butte County Public Health or the local hospitals. We are overwhelmed with emails and phone calls, and all of the information that we have for the public is on our website or is available by calling the call center. Again, 552-3050. As always, the vaccine, it can protect you, your family, and the community. It really can help us get back to normal after this long pandemic. So we encourage you, when the time comes and the vaccine is available to you, that you take that step to protect yourself and the community. As always, stay safe and healthy. Thank you.